we have to kind of do that at that state level
Mm-hmm.
too. We have to be able to bring everybody that touches the food system together to find solutions together.
Mm-hmm.
And so while I think it could be policy A, B, C, and D that
Mm-hmm.
could help, I think it's going to be more powerful when we come together and spend the time and work through those really hard discussions and figure out, okay, what is going to be unique and what is South Dakota's unique need and how do we fill it together? Because we have to. Not one solution is going to be fixing this issue.
Welcome back to 50 Faces of Feeding South Dakota. We're so glad you're joining us as we continue to have conversation about food insecurity and the fight to end hunger here in our state. We know that it takes all of us working together. And so today we've brought to the table Jen Folliard with Health and Nutrition First. And she's going to share with us a little bit about her experience across the nation with food insecurity and the fight against hunger, as well as work that's happening here in South Dakota. Jen, thanks for joining us.
Yeah, thanks for having me, Stacey. I'm excited.
Good. Well, why don't you start by telling a little bit about your history? You've done a lot of incredible work in this space. So take us back and tell us where you started and why and what you've been up to.
Yeah, absolutely. Thanks for asking. I am a registered dietitian nutritionist.
Mm-hmm.
I got my degree in nutrition, and I went, and my first job out of undergrad was working with patients who were overweight or obese. But then I also volunteered with Share Our Strength, and I worked with folks that we didn't have a lot of means to teach nutrition education and to teach cooking classes with a chef. So I saw kind of both ends of the spectrum. I saw folks that had the means to make, healthy choices, and I had folks that had some challenges when they were purchasing food. And so what I noticed is that a lot of the same challenges arose. People didn't have access in the means of, like, they couldn't get to the grocery store. Sometimes people can't get to the grocery store. They also just had some just general misunderstandings about food and how it impacted their body. And so what I realized is that the environment that we live in, shaped by policy, shaped by systems, really impacts everybody across the board. Those with challenges related to buying food and purchasing food and getting to food, it creates even more challenges. And so I went back to school and got a degree in public health policy because I really wanted to make that change in the policy environment. So after that, master's degree, I did policy research, which I know sounds kind of boring, but it was interesting for me. I worked with a team of lawyers. They taught me the policy space because as a dietitian, you don't get a lot of, really in-depth policy learning. And then I went and was a professional advocate. So I did lobbying for the Academy of Nutrition and Dietetics related to food and nutrition. In DC,
okay.
Related to food and nutrition insecurity. So I represented the interests of 75,000 dietitians to members of Congress, to the agencies that administer some of these large nutrition programs, like food stamps, SNAP, school
WIC.
meals, WIC, all of those programs that are kind of run through the Department of Agriculture. So, and dietitians have a really big stake in that because they're counseling people day to day or in community about food access and making sure that there's food there for people to buy and purchase and utilize.
And enough dollars.
To make their ends meet. Dietitians have a real big say in that. They're helping people make those decisions on a day-to-day basis. So making sure that the food's there and available is important.
You've touched on a lot of root causes of hunger that we've talked about in other episodes of the podcast, and we'll continue to have conversation about. But one of the things that you talked about that I just have to share a little funny thing is the Department of Ag, because when I started with Feeding South Dakota 3 years ago and came into the role, I did not realize how much the Farm Bill impacts this work. So, I mean, my husband's in the agronomy industry. I've been exposed to all that. I thought of Farm Bill as like insurance, crop insurance, and like for farmers. I didn't realize that about 70% of that bill is on the nutrition side, and that those dollars help fund the SNAP program as well as some of the food that we receive and food banks across the nation receive from the USDA. And
Yeah.
so I've had, I laugh a little bit about your dietitians didn't get a really good, because the year I started, the Farm Bill was coming up for renewal. And so it was sort of a let's go type of thing. And I had to fast track and learn quickly about the Farm Bill and about, advocating, not lobbying, but advocating in DC and with our national delegation. And um, it is kind of a steep learning curve. And
Hmm.
I've only looked at one policy, and there are several that
Yep.
impact this work. So, well, it just really, your experience has really set you up for the work that you're doing now with
Yeah.
Health and Nutrition First, which is how I was able to engage with you. So, talk a little bit about Health and Nutrition First and what you're doing through that.
Yeah. So Health and Nutrition First was like a proprietorship that I started here when I came to South Dakota. I really wanted to figure out how to bridge the policy skills that I had honed in DC and bring them to South Dakota in a way that was going to be purposeful and meaningful. The other thing I wanted to do when I got to South Dakota was really understand how those programs and policies that I was advocating for in DC actually worked,
How they translated.
how they translated.
Yeah,
Because
yeah.
I mean, we would be talking about examples from different states in DC, like this is working in this state and this is working in this state. But until you run a program or until you see how it works on the ground, there's really no way to to explain that to
Mhm.
policymakers in a way that's going to be meaningful.
Mhm.
And sometimes the people here who are doing the work, it's a lot easier to explain the work and it's a lot more impactful of a
Yeah,
story.
yeah.
So I wanted to really understand that from a perspective of doing. So I did spend time, I had my business going, but I also was doing work for the state of South Dakota, really understanding what are the dynamics of this state. How does food get where it needs to go in a very rural place?
Mhm.
Are there pockets where we have, big disparities in access to food, obesity rates, food insecurity rates? What do those look like in this state, and how are those communities addressing it? So I did some work for the state of South Dakota in a couple different roles, administering some of the programs, but then also going out and doing some of the
Mhm.
programs.
Mhm. So it's obvious you're very passionate about this work. And, our mission to end hunger is a lofty goal. And for 50 years, that work has been in place here in South Dakota through Feeding South Dakota as an organization in various ways. And sometimes you feel like you make headway, and sometimes you wonder if you're ever going to make headway, right?
Yeah.
But there's always a driving force, right? There's something that keeps moving you forward. And when we look at the vision statement for Feeding South Dakota, it's really that we envision a state where everybody has the well-being and the access to food that they need to thrive, to live their best life. And I say that to bring us around to talking about the impacts of not having access to the right food at the right time on people. And I know you shared you've worked with a couple different segments, but I want to break it down even a little bit more and talk about. I want to start with children, because it's a hot topic right now.
Yeah.
Um, in the COVID pandemic, there was free school lunch for all,
Yep.
and I know our state has had that conversation, and other states have adopted it. And I don't want to go down that road, but what I do want to talk about is why that access is important. And through Feeding America, we understand that if a child is hungry at school, it's hard to focus,
Hmm.
that they're more likely to have some behavior issues and things like that. Can you expand a little bit more on what it looks like for children who
Yep.
don't have access to food?
Yeah, and I think that you talked about driving force. That was that was why I got into this work, was seeing kids that didn't have access to food. My mom was a teacher. She taught reading in a Title I school, meaning that there was a high proportion of kids that had families that were low income. And those children, my mom would have a box of snacks with her at all
Yeah, yeah.
times. And so sometimes when I didn't have school, I'd go in with her and I'd ask her a lot of questions about what that looks like. And so that is my driving force.
Mm-hmm.
When you look larger at some of the statistics related to how food insecurity impacts children, you can start like in the womb. So if you have a mom that is food insecure, that impacts how that child develops. And then from prenatal all the way to age 5, you're really looking at some huge brain and growth development for children. And nutrition is a huge part of that brain and growth development. Let alone just generally when there's food insecurity within a family, there's a lot of stress and chronic stress that impacts development of children, impacts general like the adults in the family. When a child gets to school age, and I think you mentioned a little bit about this, but concentration, behavior problems, growth stunting, all of those are impacts of what happens to a child during the day. And there was a reason my mom had her like
snack basket,
her snack basket, her snack basket of granola bars is because she would have kids that came in that had reading issues, or that were slow to read, and they were also hungry. And so she just would hand them the granola bar, and work with them one-on-one on the word "the" for 45 minutes. So I think it really does impact. Those are little bodies and little brains, and they're very susceptible to their hunger cues.
Well, and Feeding America, through some of their studies, it shows that kids who are in a food secure situation on the regular are more likely to test behind their peers in educational scores and things like that. And I think there's so much compassion for childhood hunger because kids can't change that situation themselves, right? They can't go out and get a job, or they can't, so they're inherently in this situation. And it really is about, when we think about our backpack program or our school pantries, we can meet that need now, or the free lunch or reduced lunch, right? While the child's in school, they can meet that need. But it's about, again, going back to what's the situation. And in conversation with some of our agency partners, that living can be cyclical, right? I mean, it can go from generation to generation, and you have to break that cycle. But you have to empower the adults, and that too can have its challenges, because the purpose for the food insecurity in that family could be a mental health issue to begin with, or a disability that prevents employment opportunity. Could be where they're physically located. Maybe there's not food access in that area. So there's a lot of factors in play. But the longer those adults also go without access to food and that nutrition, that has impacts as well.
Yeah, and I study after study shows that adults will not eat to make sure that their children are eating. And so the impacts on those adults, we've seen absenteeism from work. We've also seen just more chronic diseases. And so it's kind of, the chicken or the egg, when you're talking about how we empower adults and communities. Do we need more food security to improve work, to improve the type and the thriving that's going on in communities?
Yeah. So I'm going to use the word food safety net, which is a word I've had to come to absorb. But really, that is that casting of a net that makes sure food is accessible within an area. And so, to your point, you can saturate. There's food deserts and there's food swamps. You're either saturated with food or you're not. But you can saturate a place with food, and you can meet that current need. But some of this is a long-term issue. You mentioned chronic diseases. So when you don't have the right nutrition, you're more likely to have a heart issue or be prone to diabetes, or because our bodies process food in a way that makes our bodies work the best, right?
Yes.
And so it's not just about getting food to people. It's about the right food and the right education and information and all of those pieces.
Yeah, the food system or the food safety net is complex, right? And there's a lot of factors that go into whether people have access to the right food and whether they're able to purchase it and consume it and cook it. And you need all those players at the table. So you need the nutrition educators, you need the doctors, you need the teachers, you need the grocers, you need all of those food safety net programs that we kind of discussed. So the food stamps, WIC,
Yeah.
school meals, all of those kind of work in tandem and together to ensure that families are able to eat and bring the healthy, making sure that the food is healthy.
And that, when we talk about those programs, SNAP, food stamps, WIC, all the nutrition programs that provide dollars or types of food to people, the commodities that we distribute, um, really, it's not a long-term situation for a lot of people.
Yep.
It's a bridge to the current situation to the next best situation. And so I think there's a bit of a misconception about who utilizes those programs and why they're so important, because it's not people who just choose not to get a job. There's rules and there's things around it, right? That if
Yep.
you're employable, you have to be, seeking or working in order to get that access. But it is such an important piece of the puzzle, having that nutrition benefit in place, because it also gives choice when they go to the grocery store.
Yep.
So they can buy an apple instead of the oranges that they may receive from one of our programs, or they can buy the percentage of milk that is best for their diet. Or I'm celiac, and so we don't distribute gluten-free foods through our mobile distribution, but they can meet their dietary needs when they have those programs.
And that choice is important, to be able to have that choice and know what your family needs. You talked about empowerment. That is an empowering piece
Yeah.
of this puzzle, right? So making sure that people continue to have that choice and that autonomy, even if they're utilizing benefits. We as a community, and as in South Dakota, we want to make sure that our communities are thriving. And to do that, you have to help people when they're in trouble. And sometimes, like you said, it's episodes of someone lost their job, or someone got sick, and so they're not able to work as much. And when those episodes come up for a family, it can be extremely stressful. And knowing that there's those safety nets there to really make sure that we don't fall into bankruptcy, we don't fall
Right.
we don't have to lean on we're leaning on our community,
Right.
really.
Right. And food is such an essential. So
It
it's an immediate need that has to be met, because you have physical symptoms of food. Your stomach growls,
Yeah.
you lose your concentration, the fatigue, all the things that increase the longer you go without food. And so that has to be resolved and met in order to help you move on to that
Yes.
next thing, so that it doesn't become chronic. But let's go back a little bit to long-term chronic
Sure.
disease,
Sure.
because you've worked in the space of working with obesity, and those stats just keep getting,
Yes.
just like food insecurity, more and more staggering.
Yeah.
And not just with food insecure individuals, but to your point, food secure individuals,
Yes.
right? We just live in a society of convenience food and the types of food that taste great
Right.
but aren't great for us.
Right.
And so I think I even had somebody shared a statistic that by, I don't remember the year, but like only 23% of people will be eligible for the military because of
Yes.
obesity
Yes.
or a chronic disease
Yep.
related to
Food.
nutrition issues. So talk a little bit about how can we change that? How can we and I know like there's years of knowledge and information, so we don't need a diet plan or
Right.
a how to balance your plate, but how we live in a state that's, you said, mostly rural, right?
Yeah.
And so when you get into rural communities, sometimes the fresh foods or the most nutritious foods are the most expensive because it costs more to get them there,
Yeah.
right? Or you might be in communities that don't even have that access at all. So why is it important that we're continuing to work those type of foods into those places?
everybody wants to make or have the ability to make a healthy choice. I firmly believe that. I think it's just there's a lot of pressure from our biology to say, okay, we're programmed to really like salt and sugar and fat. Those are things that our ancestors, I was explaining this to my daughter the other day, these are things that our caveman ancestors really needed, and we need them too. But now, like you said, the food supply is it's got a lot of those things in it because those are things that we're programmed to really like. And so it can be hard when you're making a choice within, and you have a lot of choices in a grocery store in some areas, how to make that healthy choice. Now, you mentioned when there's not a lot of choice in a grocery store, or the choice is cost prohibitive. You want to make the healthy choice, but this fresh grapefruit is 3 times higher than this grapefruit juice.
Or even, I've talked with homeless individuals in Rapid City who, if they have $20, they're going to go buy burgers off the dollar menu at a fast food restaurant because they can throw those in their backpack and keep them for a week.
Yep.
And it's not the right choice in our mind when you think about, the impact to the body, but you can't buy, much in the way of nutritious food with that $20 that you can with a filler food like that.
Yeah. And again, we're programmed for calories. We're programmed for sugar. We're programmed for fat. We're programmed for salt and all of those things. If you're not getting your basic need met, housing, clean water, food, and you're talking about folks that are unhoused, they're not getting their basic needs met. And so they're going to go for what's needed at the most basic level. And so it makes sense. That makes sense to me. And I think what's interesting and what I've learned, so sitting in that DC seat, you're you're funding programs, you're thinking about research on how to address these problems. Because when you asked me, how do we change this? I was like, whoa, this is 20 years of my life, right? I'm like, I've had to learn a lot.
How do I break this down into 3 bullet points?
Yes. I was like, wow. But I think what I learned in DC is that you can fund programs, you can fund research, you can think about how this might impact your state, but really where the rubber meets the road is when you're in a local community and you're seeing 25, folks come out of the shelter at night and head on over to that fast food restaurant. And you're thinking, like, how do we help this? What do we do to address this issue that's happening right now in our community? And it's so community specific. And so I think, you said, like, how do we do this at a larger level? I think that the policy piece is so important, making sure there's funding, making sure there's programs, making sure that people have access to food and healthy food through funding and programs. But I think some of those very unique solutions are going to be at that community level.
Yeah, and one of the things that we have been doing as a food bank in the last couple of years that's really picked up popularity is wellness pantries. So we have wellness pantries, and they're located right within a clinic. And so when a patient comes in and they're screened food insecure, you go into the doctor and they ask you all those questions about your, well-being. They add in food insecurity questions. And if they screen food insecure or they're diagnosed with a chronic disease or need, treatment of some of the chronic diseases that food can help with, they can be referred to that pantry where they have that immediate direct access and then have access to a dietitian who can help them read labels or talk to them about how to, how to eat to treat the issue that they've been diagnosed with. And the terminology is in flux, I think, but we call it food as medicine.
Yeah.
But there's many other ways, food as medicine, food is medicine, that type of thing. And we've had just a lot of interest in expanding within clinics across the state and building more pantries in. And maybe I'm naive about it, but it feels like this is like sweeping the state recently. But I'm guessing it's been a conversation for longer than that. It's just taking some people a while to come around to that. So talk a little bit about food as medicine and what that looks like for impact on people.
I think food as medicine has kind of been around for a long time. I mean, I think any physician, nurse would tell you, like, we are always concerned, or dietitian would tell you in that healthcare space, we're always concerned about what our folks are eating. But in the last 20 years, where food is medicine and that real movement that has come out in the last 20 years, it started with the Ryan White Care Program and thinking about how to serve folks that are infected with HIV. And so it's kind of come out of this space of like, we actually know for medicine. So if you take this medicine related to, it started with HIV, you need this food to make sure that you're eating. So it started there, but then the results were immense. And so we started seeing food as medicine programs that were in federally qualified health centers. So we started seeing food as medicine programs that were in hospitals. And so like you mentioned, your wellness pantry, that is a food as medicine program. When people screen for and they screen positive for food insecurity, meeting that need right then and there is so powerful. So being able to walk downstairs, talk to a dietitian after you've got this, heart disease, cancer, diabetes diagnosis can be so powerful. That dietitian within that wellness pantry can help guide those food choices within the pantry right then and there. The original Food as Medicine program actually is the WIC program too. So it's the same kind of concept. You have a dietitian that's sharing, that's doing that nutrition education with pregnant moms. And it's another time of life where it's you're vulnerable, right? And you're willing and you're thinking about, okay, I know that this food is going to make me feel better. And in the case of the pregnant mom, it's going to make me and my baby feel better. And so, there's just, I think when we get those big life changes and diagnoses, it's a real important time to kind of go back to basics. This food is medicine, and this is how we can help treat you. So I'm glad it's sweeping our state. It's been around for a long time, but I also think, getting those programs more focused on some of the larger chronic diseases that we're seeing increases in, heart disease, cancer, diabetes, obesity, all of those can be treated with food as medicine.
So you now I'm gonna veer off a little bit because we talk about sweeping the state.
Yeah.
But really it's implementation.
Yes.
And you and I first met by chance. And it just kind of worked out perfectly because I came to you and said, hey, we're doing this work at Feeding South Dakota, and it's meeting a need right now in communities through our programming. But we know there's more to this than that. We know that there's a need for other solutions, and that Feeding South Dakota can't be the presence in every community, but how can we collaborate and work with other people of knowledge, people doing work that impacts this? And your experience, your 20 years of experience had almost like set you up perfectly for the work that you've been supporting us in, which is bringing together the first statewide collaborative focused on healthy nutrition, the South Dakota Healthy Nutrition Collaborative. And Feeding South Dakota, I would say I would consider us a member of that collaborative. And when I came to you with that, you said, I know the people. And it started with a coffee conversation with a few of us sitting around a table and saying, this is what we think we need. And just expanding that circle and coming to the realization that every person that we reached out to, whether it be an individual who is volunteering for a food service organization, a restaurateur, a researcher, that they all were like, we've wanted this too, but nobody's taken the reins and pulled it together. And you've done that over the last almost
We've done it.
Almost the last 2 years.
Yeah.
So because I would consider myself a member, and I would consider you the facilitator or support of the collaborative. which launched in September
Mhm.
after about a year and a half of some pretty diligent work to get it organized. Tell us a little bit about what the collaborative is and why it's important to the state and the work we're doing.
Yeah, it's like you said, it's the first statewide collaborative really focused on food and nutrition insecurity. And so our purpose is really to bring that collective voice to food and nutrition insecurity, to decision makers, to policymakers, to researchers, to people who run programs. And it's to bring us together to improve our food and nutrition security collectively as South Dakotans. And so we spent, like you said, a year and a half pulling together and thinking about, okay, the food system is huge.
Mm-hmm.
It is massive. It touches a lot of different industry. It touches every person in the state. So how do we intentionally invite folks to this table?
Yeah. And help them understand the value they bring,
Yes.
right?
Yes.
The local grocer who has grocery stores in rural communities, the value that they bring to the discussion, and the researchers, because they're doing work that
Yep.
can help us build programs, right?
Yes. And so this collaborative over a year and a half and launching again in September, we have, I think, about 35 organizational members from across sector of South Dakota businesses, community organizations. We have quite a few folks that have lived experience with hunger. And that has been a really driving force in how we develop our policies, our procedures, thinking about what kind of priorities we want to spend our time on. And so the collaborative itself has 3 different goals, and I'm happy to share those with you if you're interested. So there's 3 goals. One is to really think about, our first one is to really think about how the myriad of programs throughout the state work together or could work better together or coordinate better. So
as a clarifier, the collaborative itself isn't going to build programming.
correct.
What it does is it brings those of us that are doing programming or considering new programming together to look at what's already happening.
Yep.
So we're not duplicating services, and we're even piggybacking off of each other. Where Feeding South Dakota might have a mobile distribution, there might be another organization that wants to come in with nutrition education to complement the giving of food with the educating on food.
I heard one of our collaborative members say we're coming from a stance of abundance versus scarcity yesterday, and I think that we do. We have an enormous amount of passion and resource and expertise on the collaborative, and so really it's giving us a space to have those conversations.
Yeah. With like-minded people.
And so those organizations and individuals have dedicated their time, and time is precious, right? So have dedicated their time, so they see value in coming together and thinking about, okay, how can we do this better? How can we coordinate? How can we grow? How can we, we're not interested in duplicating programs. And so I think that's our number 1 goal. Our number 2 goal is really thinking about how do we lift up those folks that have lived experience with hunger or live in communities that experience a really disproportionate or more than normal rate of food insecurity. So thinking about how we tell that story, and those folks should be the ones that tell those stories, but thinking about how to do that in a really respectful manner.
Yes. Yeah.
The third goal is really thinking about policy, that to make sustainable change, we do have to take a really hard look at some of our systems and policies in place and see if they're working. And that's where those expertise from programs and research and from lived experience can really contribute to that conversation around, okay, well, this is the policy that we have in place in South Dakota. This is the system that we have in place in South Dakota. Is this working?
Yeah.
Like,
here's the impact. Yeah. And also not just on like nutrition programs, policy around greater things like housing and childcare and things that can impact a family or an individual's lifestyle and potentially bring them into that food insecurity, right? So it's a holistic look at the work that's being done, and it's so exciting. I have to say,
It is exciting. I would agree.
And it's more than I could have ever expected when I had the initial conversation with you, because what has been so great about it is that all the things that people have brought to the table and understanding where our energy is going and being able to say, okay, well, I don't have to worry about that piece because I now know they're taking care of that over here. Or I want to incorporate this piece and now I have that source to go to because they're doing that work, and how can we bring that together? And so additionally, we have state agencies as part of this
Yes.
collaborative. And so it really is, to your point, like melding everybody together and bringing us together to work together. And we're still in our infancy. We're
We are.
still, not taking position on policy. We're
Nope.
still trying to figure out how we're going to, gather all of our expertise and our knowledge and our data together to make it accessible and consumable. But I am so excited for the possibility of what this collaborative can do as we move into the future. And so that leads me to, for 50 years, this work has been happening in South Dakota, starting with, food banks on each side of the state that saw a need and wanted to fill it to where we are today, serving every county in the state. And so we now have the opportunity to say, well, what does the future look like?
Yeah.
And if we want to achieve that mission of ending hunger in South Dakota, how do we get there? And so share a little bit about how you envision, or what you envision would have to be happening over the next several years in order to make sure that everybody has that access to food that can help them thrive.
Yeah, I think we're taking a big step towards that with this South Dakota Healthy Nutrition Collaborative. I think to make, and I'm going to try to draw a real big parallel. So when you talked about the Farm Bill and just how big it is, it's looking at producers, it's looking at consumers, it's looking at the environment.
Yeah.
We have to kind of do that at that state level
Mhm.
too. We have to be able to bring everybody that touches the food system together to find solutions together.
Mhm.
And so while I think it could be policy A, B, C, and D that
Mhm.
could help, I think it's going to be more powerful when we come together and spend the time and work through those really hard discussions and figure out, okay, what is going to be unique and what is South Dakota's unique need and how do we fill it together? Because we have to. Not one solution is going to be fixing this issue. And you and I want to work ourselves out of a job, right? Like
How many people say that?
we want to work ourselves out of a job. That's what I've been going for my whole career. And I know I've heard you say that too. So I think to do that and to really make sure that we're finding solutions that are going to work for the unique communities in South Dakota, we have to have everybody at the table. And I think that we're in a good place with the South Dakota Healthy Nutrition Collaborative to do that. I also firmly believe that policy and systems help sustain disparities, so help sustain issues with who has and who doesn't.
Mhm.
Disease burden, food insecurity burden, and so we really have to take a hard look at that. And so I know that the collaborative over time will be able to do that.
Mhm. Well, I have one question for you before we go, and this is my my trick. It's not a trick, not a trick question,
Oh,
but this is
no.
my out of left field question, and I'll give you a little bit of time to think on it if you need it. So, if South Dakota were a fruit or a vegetable,
Ooh.
what would it be, and why?
Okay, so I think I've got it.
That's great.
I don't know why.
Seriously, I didn't tell you this ahead of time.
It's got to be. So my mind went immediately to a root vegetable
Okay.
because.
Any specific one?
Yes.
Oh, okay.
Yes,
Okay.
I'm going to get there.
All
I
right.
was like, it was either going to be beets, carrot, or rutabaga.
Wow.
Yep.
You are a dietitian.
Yeah. And so I really think it might be the rutabaga.
Okay, tell me one way you would eat a rutabaga.
So the reason I say that is because when I moved to South Dakota, I still really have only eaten a rutabaga one time.
Okay.
But people here are like, they have talked about this vegetable and they continue to talk about it. So That's when you said South Dakota. What is South Dakota's fruit or vegetable? I was like, it's got to be this, because I didn't even know I didn't even know people actually ate this vegetable until I got here.
So is that like people don't actually know about South Dakota until they get here?
That's
how you equate it to the rutabaga? And our roots are deep.
And your roots are deep.
No, but seriously, go back. How do you eat a rutabaga? How did you eat it the one time?
I think I had it like someone had pulled it out of their garden and like we washed it and I took a little slice of it. That was the first time
Interesting.
Yes.
A rutabaga. Well, I was not expecting that. And it's great. It's great. We haven't had a repeat yet on the type of fruit or vegetable.
Yeah.
So I appreciate you sharing that with me.
Yeah, no, absolutely.
That was a quick thought. So well done. Well done.
Yeah, well, I think about fruits and vegetables a lot.
I bet you do. Well, thank you very much for joining us today in this conversation with Jen Folliard and the opportunity to talk about all of the impacts of food insecurity and food access on not only individuals, but what it looks like from a policy and systems and program standpoint, and the exciting work that's happening through the collaborative here in the state. We hope you join us next time. Make sure you try a rutabaga before you come back. Thanks for joining. Bye.